Joint pain is something so many of us deal with, but we don't always know what's really going on. That ache, that twinge, it's more than just an annoyance. It's actually a signal from your body. So today, we're going to decode those signals and figure out what they really mean.
We've all been there, right? You get up from a chair and your knee just screams at you for a second. Or maybe you reach for something on a high shelf and your shoulder is like, nope, not today. It's a feeling we all know. But what is actually happening in there when we get that jolt of discomfort?
All right, before we dive deep, let's just make sure we're on the same page. A joint is simply where your bones meet up. That's it. These are the hinges of your body. Your shoulders, your hips, your elbows, your knees, and they're what give your skeleton its amazing ability to move around.
Okay, so we get what a joint is, but the million-dollar question is, why do they hurt? And while you could probably make a super long list of potential reasons, the truth is, most of the time it boils down to just a few usual suspects.
And here's the big one. 9 times out of 10, when you're talking about chronic joint pain, you're talking about arthritis. It is by a long shot the #1 cause. But here's the catch. Arthritis isn't just one single thing. It's an umbrella term for 2 very, very different conditions.
So let's break that down. On one side, you've got osteoarthritis, or OA. The easiest way to think about this is just wear and tear. Over the years, the cushy cartilage in your joints just starts to break down from use. But then you've got rheumatoid arthritis, or RA, which is a whole different ballgame. This is your own immune system going rogue and attacking the lining of your joints. It's not a mechanical problem, it's an autoimmune one.
And just to give you an idea of how serious rheumatoid arthritis is, a whopping 1.5 million Americans are affected by it. This isn't just some minor inconvenience, it's a major health condition that can cause some serious damage if it's not managed the right way.
But of course, it's not always arthritis. Your joints can hurt for a whole bunch of other reasons. It could be inflammation from something like bursitis or tendinitis. It could be a side effect of an infection, like the flu, or it could be a straightforward injury from overuse. And sometimes it's a symptom of a much larger condition, like lupus or fibromyalgia.
All right, so we have a pretty good idea of the why. Now let's get to the really practical stuff. How do you know when an ache is just an ache and when it's a red flag telling you it's time to call the doctor?
Okay, so here's your checklist for when to make that appointment. If you honestly have no idea what caused the pain, that's a sign. If you see those classic tells of inflammation, the area is swollen, red, tender, or feels warm, that's your cue. Also, if the pain just hangs around for more than 3 days, or if you spike a fever but have no other flu symptoms, definitely get it checked out.
But then there's the next level. These are the symptoms that mean you don't make an appointment for next week. You go to the emergency room now.
If you're experiencing any of these, it's serious. We're talking about a major injury, a joint that looks visibly out of place or just wrong, or swelling that comes on super fast and super severe. And the big ones. If you literally cannot move the joint at all, or the pain is just off the charts unbearable, don't wait. That's a trip to the ER.
So you've made the right call and you're seeing a doctor. What's next? Let's quickly walk through what that process looks like, from figuring out what's wrong to getting you some relief.
It almost always starts simple. It starts with a conversation. Your doctor's going to do a physical exam and just ask you a whole bunch of questions about the pain. They're trying to play detective and narrow down the possibilities.
To get a better look, they've got some tools. A joint X-ray lets them literally see inside and look for damage from arthritis. Blood tests are how they screen for signs of those autoimmune disorders we talked about. And there's this thing called the sedimentation rate test, which is really just a way to measure the overall level of inflammation in your body.
Now, once they figure out what's going on, especially with chronic stuff like arthritis, here's the good news. A lot of the time, the first line of defense is stuff you can do yourself, right from your own home.
This usually comes down to a 4-part game plan. First, using things like topical creams or over-the-counter anti-inflammatory meds. Second, and this is so important, staying physically active with gentle exercise. Third, stretching before you work out to keep everything flexible. And finally, and this one is huge, keeping your weight in a healthy range. It takes so much stress off of your joints.
But, sometimes what you do at home just isn't going to cut it, and that's okay, because that's when your doctor can step in with some more direct medical treatments.
So what might they do? Well, they might need to draw a little fluid out of the joint to test it. That's a great way to diagnose an infection or gout.
For rheumatoid arthritis, there are some incredible medications that can actually push the disease into remission. And then, in the most severe cases, surgery to replace the entire joint is definitely on the table.
So we've covered the causes, the red flags, the treatments, the whole shebang. Let's kind of zoom out now and talk about the big picture and what you should really take away from all this. I think this quote just nails it. It perfectly captures the two sides of this coin. On the one hand, yeah, some joint pain is just a normal part of living life. But on the other hand, it can be that first warning bell for something much, much more serious.
And that brings us to what is, without a doubt, the single most important point here. Please do not just ignore pain you can't explain. Getting an early, accurate diagnosis is everything. It's the key that unlocks effective treatment for the real cause of your pain, not just masking the symptoms.
So the next time you feel that creak or that pop or that ache, just remember, that's your body trying to have a conversation with you. And the only question is, are you ready to stop and listen to what it has to say?